Quick thing I want to say, and those are who involved would understand where I'm coming from. If you have a 24-hour aide, a lot of the people think that after 13 hours you should force the person to go to bed. I think the system, how it treats disabled people and the elderly, need a long way to go. This is supposed to be America, but a lot of the resources that people should be getting don't get, and it goes undeservingly. And I feel like if they tell aides not to take a patient out, you could only take a patient out so far. Depends on the person's situation, especially if the person is not elderly and still young. And secondly, even elderly deserves. I mean, we need the help, but we don't need to be imprisoned and we don't need to be bossed around, especially in our own house. It's like um, it goes even back to the days of civil rights, separate but definitely not equal. And I just want to say that disabled people deserve all kinds of resources, and they deserve to go to bed whenever they want to. Whatever happened to patient-centered care? Whatever happened to, aren't we grown-ups? Don't we have the right to live? Don't, just because we're disabled doesn't mean we're not still human. Uh, you know, we're not lab animals, we're not children. We deserve the same self-respect. I think the great Christopher Reeve said it best when he got into his accident. People were coming up to his face like he's a little baby, and he mouthed it. Even though he wasn't able to speak properly, he said, I am 43 years old. I am not a baby. Basically, home health services and disabled services and the government and Medicaid and Medicare really need to look at human rights first and foremost, and not just about what a book says and trying to cut off money and cut off services, be cheap, cut out the middleman. Supposedly the reason why they put people to bed early or try to force people to go to bed early is because they say they're only getting paid for 13 hours. But sometimes, honestly, it's not even about the money, and it all depends how you use that 13 hours. You could be chilling and sleeping while the person watches TV. You don't have to necessarily put the person to bed. Spread out those 13 hours, even if it's in the day. And it should be flexible anyway, because it's living. Really need to look at the situation. Everybody's trying to be politically correct, but honestly, they're not. They think they're protecting us, but honestly, they're not. It's hurting us. When do we get a chance to feel like the shackles are off and we're our own free people? Thank you. And now you know what the deal is.